In Video 1, we explored finding formal academic resources and non-traditional or informal resources. Keep in mind, both formal and informal sources can be credible. Once you have selected an article or resource, determining the credibility of the source is the next step. It is important to authenticate the information, and choosing credible sources is one way of mitigating this concern. A credible health sciences resource is one with reliable information that is accepted by the larger healthcare community as a trusted source or expert. For formal sources, the easiest way is to select articles from a peer-reviewed journal. For informal sources, there is a greater responsibility on you, the student, to check credibility. Peer review means other healthcare professionals and experts reviewed the article and findings and approve it for dissemination among the publication's audience. This can be checked on the publication's website. Alternatively, during your searches using the Himmelfarb database, you can select only articles from peer-reviewed sources. The Himmelfarb library databases will be covered in the library videos. What happens when you find information that is outside of a peer-reviewed journal or publication? Can you still use the information in your research or assignment? The answer typically is yes, but you first must consider how credible the source is. First, consider the author's credentials. Why would he or she be considered an expert on the topic? Second, does the author note other credible sources? The author may convey information in an informal way, but if the sources cited are credible, then it could lend additional weight to the source. Third, you can check the author's credentials to verify their level of expertise, and you can check other sources to verify information. What academic credentials does the person have? Can you verify their expert claim by looking on a university or government website, such as GW or the National Institutes of Health? Let's try an example. Here we have a blog from someone who claims to be a physician. Remembering our format from earlier, first consider the author's credentials. Why would he be considered an expert on the topic? Second, does the author note other credible sources in the blog? Third, you can check the author's credentials to verify the degree of truthfulness. What academic credentials does the person have? A quick Google search on the name Dr. Matthew Mintz, and we find his profile on the GW MFA website. The site confirms his academic credentials and also areas of expertise and interest. Next, we are looking at an informal source, another blog, but this time by a group and not an individual. What factors should we consider? It is always important to follow the money. Asking questions like, who supports this group? And who are the major funders of this organization? Are critical in determining the trustworthiness and what bias may be present in the information. A Google search brings up the organization's website. Looking for an About section is a natural first step. Under the Facts header, we will find a link to information about funding. We also find information about members and supporters. Additionally, you can also see what policies and programs the organization supports. This information will help you determine how credible the source is, which will guide how you use the information reported. Your healthcare field has a collection of top-tier journals or sources most commonly used in academic research. Much like visiting a shopping mall, these are the flagship stores anchoring the academic enterprise for the field. In your assignments, the faculty will expect that you are familiar with these publications and citing material from these sources. While these are not the only places to search, it is essential that you are comfortable exploring these sources and understand the strengths and limitations of these journals. These should be your go-to inquiries during your initial searches. After searching these top sources, exploring second-tier and informal sources is appropriate. For example, an informal source can provide additional support in existing arguments or point to a new direction in practice. Many peer-reviewed articles take months or years to get published, so informal sources often have cutting-edge information. However, you do not want major arguments in your assignments only supported by informal sources. Please be sure to review the library videos to hone your search abilities.